Tomorrow marks the one-year anniversary of China locking down the city of Wuhan, the city of the first, or the site of the first outbreak of COVID-19. And while the rest of the world dismissed the virus as a China-specific issue, doctors and nurses in Wuhan hospitals faced off against a new, fast-moving threat, caring for patients and trying to determine how to effectively battle this unknown virus. Those early days are captured in the new documentary 76 Days. And here to tell us about it is the director, Hao Wu. Hao, thank you so much for joining us. I watched the documentary last night. Really emotional, really well done. Tell us how you decided to take on this story and how on earth your team got access to hospitals when China was, frankly, really paranoid about the optics of the virus outbreak.
Yeah, first of all, thank you so much. I'm really glad to be here and to be speaking about the 76 days. I went back to China January 23rd, 2020, a year ago. I live in New York. I flew back to Shanghai on that day to spend Chinese New Year with my parents, my sister's family. And just so happened that was the day Wuhan was put under lockdown by the government. And it came as a shock to me and also to most people in China, because very few people in China had known by that time how serious the situation was in Wuhan. So I spent 10 days pretty much holed up in my sister's apartment. Very few people were walking outside in the streets of Shanghai. And just spending Chinese New Year that way in China's biggest city, with nobody celebrating the holiday publicly, was a very eerie experience. So as soon as I came back to the US in early February, when a US network approached me, asking me if I wanted to make a film about coronavirus, I jumped down. And even though later on the US network dropped out, and I still continue independently. So the way I did it was I reached out to filmmakers who had started filming in Wuhan already in early February, and some were filming inside of the hospital, some were filming outside of the hospitals. And through that process, I found my two co-directors. And as soon as I saw their footage, I was so shaken and awed by their footage, and I asked them to collaborate together.
Yeah, it's remarkable because the city of Wuhan is a city of 11 million people. And I know the city was in lockdown, but in your documentary, it looks empty and bare, and there's hardly anyone. And all we see are the corridors of the hospitals and the doctors and the nurses treating their patients. You follow several main characters. There's barely any mention of the government. And it's striking to see the story focused on individuals. What do you want people to walk away with after putting faces to the tragedy in Wuhan?
I think even up until today, I think a lot of times our understanding of COVID-19 has been around statistics. We talk a lot about the numbers. There has also been a very obvious political divide around how we should respond to COVID, including whether to wear a mask or not, or whether COVID-19 is real or not. So I feel like for me, for me, our goal with this film is really to highlight the personal stories and the human tolls that COVID-19 is exacting on our people everywhere. So I think, first of all, I really want this film to bring home the message that COVID-19 is truly real. It's not a hoax. And you can see in this film how patients suffer, how much damage the disease is inflicting on individuals and families, and also how courageously our health workers are battling this disease. And secondly, I feel like in this film, you could see how the way that China had put under COVID-19, the outbreak under control in Wuhan, because the people, the medical workers and the patients, they work together to battle this. And I hope we can see more of that in the rest of the world as we try to continue to battle this pandemic.
And you had mentioned this earlier, how you were working with co-directors in Wuhan. This was clearly a transcontinental effort. The videographers on the ground were in Wuhan, and they would film everything, and they would upload it to the cloud, and then you would download it in New York. Talk about what that experience was like. I mean, you must have had hundreds of hours of footage.
Absolutely. I think every day my two co-directors, they went inside the contamination zone and filmed. They couldn't even take their equipment out because that would require some thorough disinfecting with alcohol that would, have destroyed their equipments. So they will bring their discs out and upload the footage onto a cloud service in China. And I would download them in New York. And because of the Great Firewall, there was always a few days delayed. Once I reviewed the rushes, I would just have more discussion with them about, the direction of the film. But primarily, my co-director made decisions on the ground just because the situation there changes so fast. I mean, if we, maybe. So for some of the patients we were interested in initially, they will be transferred to a different hospital, or some of them even passed away.
All right, final question to you, Hao. You mentioned how the company that asked you first to work on this documentary dropped the film, but you did end up hooking up with MTV. How did that work?
We premiered, luckily, we were the first film about the COVID-19 out at the film festival circuit. And I think after we premiere on Toronto International Film Festival and our second festival at Heartland International Festival, MTV, one of the senior executive at MTV documentary films, Sheila Nevins, she was on the jury. She saw the film, she just fell in love with it. And things just happened really quickly after that. We were very lucky to be partnering with MTV documentary films to bring this film to the audiences.
Hao, thank you so much for joining us. Hao Wu is director of 76 Days, a really incredible documentary. And Renita, I think about the contrast between what I saw in that documentary with what we heard in New York, where doctors didn't have enough PPE, there were patients in the hallways.
Right.
What I saw in that documentary was really organized. I mean, all the doctors had plenty of PPE. It's such a contrast.
Such a contrast. And you know what? I'm going to check that out over the weekend because I'd love to hear what Ground Zero was dealing with.
Yeah. Incredible.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.